It is time now for Conversations in Health, and this morning we are discussing ACL injuries, which sees more than 200,000 cases per year. And joining me this morning is Dr. Mark Bowen. He's an orthopedic surgeon and sports medicine specialist with North Shore Orthopedic and Spine Institute. Boy, that is quite a title.
It is a big title.
Well, this is a subject that is interesting to so many people, with that many people having that injury. Well, first of all, let's discuss what is an ACL tear and how do they occur?
So the ACL is called anterior cruciate ligament, and injuries to the ACL are significant because it is the main stabilizing ligament in the knee. It's basically a rope of collagen that goes through the center of the knee that controls stability. And injuries that occur to that can affect the stability and usability of the knee.
Yeah, and it can be very painful for people who experience it. What are the most common sports or activities that cause these ACL tears?
Well, we're just finishing the major season that we see people tear their ACL, and that's ski season. So reliably, there's a fairly high incidence of injuries with ACL in skiing, and most mountains that have ski areas see a lot of people who injure it that way. The other sports that involve cutting, twisting, turning, pivoting that you would consider as a big part of that sport, like soccer, basketball, football, volleyball, all those sports have activities that predispose people to injuring their ACL.
So if somebody feels that they may have this happen to them, how would they go about getting diagnosed? What do you do?
Sure. So the first part of that is really suspecting that it happened, and many times people feel like they just tweaked their knee or something happened. They wake up the next morning and their knee is swollen and they can't bend it as well and they limp. Already there's a little bit of a suspicion. Sometimes that diagnosis can almost be made over the telephone. But obviously you should see a physician, and they would examine you, and most of the time that diagnosis can be made just by physical exam, because what we're doing there is just testing for the ligament. Ultimately, the definitive test that proves it one way or another is an MRI.
All right, well, doctor, don't go away, because we're going to be talking more with you in our next hour when we answer your questions about ACL injuries. All right, we are back with Conversations in Health this morning, and we've been discussing ACL injuries. And back with me this morning is Dr. Mark Bowen. He's an orthopedic surgeon and sports medicine specialist with the North Shore Orthopedic and Spine Institute. Thanks for sticking around, because this is so important to a lot of people who have this injury. We've got some questions from our viewers, and we're going to shoot one at you right now. The first one wants to know, the person wants to know, my physician diagnosed me with an ACL injury. Do I really need to get surgery, or is this going to heal on its own?
Yeah, so the ligament itself will not heal on its own, and the real decision tree of deciding what to do and whether you need surgery or not rests mostly on what your expected activity level is. So people who are determined to continue to be active in sports that involve cutting, twisting, pivoting, change in direction really should have ACL surgery, because they risk further injury and more damage. Many people don't do those things on a regular basis and may do well with their knee just doing rehabilitation, making their legs strong, and controlling their activity level somewhat. So it's sort of a decision tree of activity based on activity level.
And speaking of activities, this next viewer is asking about high school athletes. This person says, I'm in high school and I love to play football and soccer. How do I prevent an ACL injury from happening in the first place?
Yeah. So the best prevention is to not participate in activities that involve the risk type maneuvers, but most people aren't going to accept that.
Exactly.
So the best you can do is prepare. And there are injury prevention programs mostly related to muscle strengthening of the core, the muscles of your hip and upper legs, and working on agility and basically strength, endurance, so that when you participate in those sports, you're as prepared structurally as you can be, and I think that's the best thing you can do going forward. There's no bracing or other types of things that really have been shown to make any difference or be preventative in any way.
Well, that's interesting. Okay, well, we have one more viewer. This person says, and this is, you know, a good question, because they want to know, what other options do you have if you've had an unsuccessful ACL repair surgery, because that does happen to people.
It does. So ACL reconstructive surgery is very, very common. way over half of the people you mentioned who tear their ACL do elect to have ACL surgery. And the success rate's over 95%, but there are a few people that fail. If you fail, you can adjust your lifestyle and activity level to something a little bit lower, or you can have it redone. Revision surgery or revision ACL reconstruction surgeries are done, and the success rate is a little bit lower than the first time, but they can still be very successful, and people can have good outcomes and be active.
Well, Dr. Bowen, I want to thank you for taking the time to explain this to our viewers.
Thank you.